Hello everyone and welcome to our live session today. I will be going, before we begin, over a quick starter presentation to welcome you all and introduce you to our program and various opportunities if you have, of course, not attended previously any of our shadowing sessions. I do want to highlight that Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals, gain access to educational resources no matter their demographic status, abilities, or location. My name is Jesus. I am the Chief of Program Planning here at Pre-Health Shadowing, and I want to thank you all for attending this meeting today. So let's get started. Just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need any assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone, so please, if you have any recommendations whatsoever for how we can improve, you can definitely email us at info@prehealthshadowing.com. So, since this is an international program, we want to know, where are you guys Zooming from today? You can drop it in the chat. I kind of want to know, okay. Oh, that's wonderful. Okay, so you guys are starting, okay, oh, wow, okay. Okay, we have people from all over. That is wonderful. I myself am calling from the wonderful island of Puerto Rico in the Caribbean. If you want to stay in the loop, you can follow us on social media. We are active on both Instagram and TikTok, or you can also sign up for our email list on our website to never miss a session. Now, we have some wonderful opportunities for you all as benefits for being part of our program. We have partnered with Kaplan to get our students a 10% discount that can be used on all Kaplan products, as well as free resources, such as study guides to help you prepare for standardized tests like the MCAT, the NCLEX, or the PCAT. If you fill out our survey in the chat, we will definitely get you signed up for these deals for free. We would also like to draw your attention to another amazing program, and that is NeoLift, which is an online mental health platform for students. For pre-health professionals especially, we know that the path isn't easy, so that is why we have partnered with NeoLift to spread the word and offer free access to their services if you use the link that was dropped in the chat or enter the code PREHEALTH when signing up. Additionally, we are really excited to announce that we have partnered up with Krispy Kreme for you to purchase one delicious dozen donuts to enjoy with your loved ones. With a donation of $10, you'll be able to receive your treat while also helping us here at PHS. More information and instructions can be found by clicking the link sent in the chat. Okay. We also just got our PHS merch, and this is another way you can help us and also acquire a really nice piece of clothing, that being t-shirts, long sleeves, or hoodies to represent PHS and our mission. Mask for Mask is another amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without their proper equipment, and others who are struggling to stay safe. And with our discount code PHS15, you can get 15% off your order. If you buy through this method, Pre-Health Shadowing will also get 10% of the proceeds, which is amazing because, as I mentioned earlier, we are a nonprofit that rolls solely off of the support of our community. If you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and team members. You can apply to be part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and a lot more. We do understand that as a pre-health student, you may not have the time. So we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would definitely love to have you be part of this program and contribute your own unique perspective. Also, wonderful news. If you are a high school student and you want to get involved, we have started a program called HTP, or High School Training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and organize resources for other high school students that are also interested in medicine through pre-health shadowing. Here at PL Shadowing, we want to recognize the hard work of all of our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief, through the link that was dropped in the chat to have your work on our website. This will definitely look great on CVs, applications, and resume. So do take advantage of this. Part of our mission here at PHS is to promote diversity. And in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and International Student Forum. If you have a mentor, professor, or professional that has inspired you in any way, and you think they could contribute to these conversations, please nominate them using the link that was also dropped in the chat. If you can, we humbly ask that you donate to our program. As you know, pre-health shadowing is completely student-run, and we are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you are not financially able, we request you send this link to someone you think can help us so we can contribute to support those who cannot afford similar opportunities. Okay, so throughout this session today, we encourage you to drop any questions you have for the speaker in the chat, and our team member will be making note of these to be asked in the latter half of the session, that is the Q&A session. We invite you all to take good notes as our professional is going over their presentation, as there will be a chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned, you guys. Lastly, if you can, we request you turn your cameras on. This is, of course, by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. We also request that you make sure to mute yourself, as this will ensure the professional has the complete and full attention from the audience. I appreciate you all for listening to me, and now I would like to welcome our professional. Thank you so much for joining us. I will be stop presenting so you can start with your presentation. Welcome.
Hopefully you can see this. Give me a thumbs up, or just shoot me a message in the chat box if you cannot see it. If I don't hear anything, then I'm just going to assume that it is working. Okay, awesome. Thank you. So my name is Khushbu. I am a physician assistant. I'm super excited to be here. Thank you all for being here today. Good afternoon, good morning, good evening. It seems like I was looking in the chat box. There's people from all over different time zones here today, which is so cool. A perk of being in the virtual environment. So this is really amazing. So thank you so much for having me today. All right, so just a quick little disclaimer slide. I received no financial compensation for this presentation. This presentation and what I'm going to talk about is based on my views and my experiences. And please refrain from sharing any content or photos without my approval. I know this is recorded, so feel free to watch whatever you need to and rewatch it. Hopefully you find this helpful today. So a little bit about me. So like I said, my name is Khushbu. I grew up in Massachusetts. I did see in the chat box a couple of people are from Massachusetts, which is awesome. I now live in California a little bit. So I grew up in a small town in Massachusetts. I went to undergrad to Bryant University for PA school, started my life in a little bit. Country to San Diego, which is where I am now. It was about 6 months ago that my husband and I made the move. We had a COVID wedding, and then we're going to get married again next year. Fingers crossed, when things are a little bit more open and we can have our extended family and friends there. And we're going to do that in San Diego, actually. So now I work in wound care. I also have experience in emergency medicine. So you'll see a couple of cases that I talk about in emergency medicine and also wound care. After I moved to San Diego, I created a platform called PAs Align. This is a place for other physician assistants to connect with each other through networking events and online and offline. I'll definitely talk a little bit more about that later. And I love to travel. I love to experience different cultures. I like to work out, make my body sweat, eat a ton of good food, golfing, and spending time with my family and friends. So what I'm going to be talking about today is my journey to becoming a PA. Tips for you as you join the medical profession. And actually, hang on, pause for that. I'll have a chat. And then my life as an emergency medicine and wound care PA. I'll talk a little bit about PAs Align and go over some cases, and then we'll leave room for some questions. All right, so my journey. So I obviously am a PA, and before I decided to go to PA school, since I was in like high school, I remember really like knowing that I wanted to go into medicine, but I wasn't sure exactly what part of medicine I wanted to go into. So type into the chat box now if you are kind of between different professions or not. And if you know what profession you want to go into, type that in. I would love to see what people are open to going into. So I basically, yes, neurosurgeon, neuro, PA, cool, amazing. I love that, PA, OB, cardio, amazing. So a lot of PAs here, plastics, medical school, between PA and MD, hopefully. I see a couple of those, hopefully this helps you a little bit. Amazing, a lot of PA. I think there was a pharmacist here, RN, awesome, so cool, NCPA, amazing. So I went back and forth for a while, and when I applied to colleges, when I was in high school, I applied to a program, actually a direct entry PA program. And I luckily got in, but I also got into Providence College and got luckily a really great scholarship. And since I was so back and forth between PA and med school, I was like, you know what, I'm just gonna go to liberal arts school, Providence College. I got a good scholarship. It's a great school. I'll get a good, education, and I got my bachelor's in biology, was on the pre-health track, and I figured I would this way get prerequisites for both medicine and PA, and then I could decide later. And so by the end of college, I probably switched my mind like 4 times during college. And then my senior year, I was on the med school kick, and I was like, I'm gonna go to med school. So I graduated and last minute actually applied to medical school. I took the MCAT and everything, and I got rejected. And the thing is, I know now it's because I was like totally last minute back and forth, and I didn't have what I actually wanted in my mind of like my goals and everything figured out. So I reassessed everything that I really wanted in my life, in my future, where I could see myself being. I shadowed physicians and PAs, and I worked in the field a little bit as a CNA, as a medical scribe. And then from there, that's when I truly understood what both professions were like, and I made up my mind. And that's when I applied to PA school, and I got into Bryant University. It was like the only place I actually even interviewed because I got in the same day, and it was just totally, and I'm super grateful for my journey because I've just learned a lot from it. So hopefully that helps you guys if you're debating between PA and med school, or if you're debating between any other professions. So poll number one, I want to know from you guys if you, so basically you are 100% sure what profession you want a career in. So if you're 100% sure exactly what you want to do, click true. If you're not really sure, click false. Yeah, so I see a little bit of both. Yep, I see both. It's almost like maybe a few more truths, but I see a good number of people that don't know. And I think that's totally normal. Okay, it's totally normal. I'm going to go through some tips later as we get further along in the presentation. So you guys are doing a good first step, which is coming to these sessions and launching them later. All right, so poll number two, what is the most important aspect of your application? Is it grades, healthcare experience, shadowing, curriculars, recommendations, or yeah, I see a lot of S. All of them, yeah. Yeah, so you guys are right. It's honestly, if you're clicking any of the letters, you're right, but all of the above. And it's all very important, right? We're all holistic beings. So just one single thing isn't going to get you into the program that you want to get into. It's all of it. So I'm going to talk about a few tips that I have for you guys. Number one is understanding your future profession and the other one. So like I said, the fact that you guys are coming on to these presentations and really getting a good idea of what PAs do, what pharmacists do, what physicians do, what the different specialties in those realms do, nurses, physical therapists. I think I saw that you guys have like so many different professionals coming on to speak, and that is incredible. It's really, really important to really understand what that job is actually going to be like in the day-to-day. And here's why. Number one, so you can see yourself in that position one day. If you cannot actually think about and really think about what you're doing every single day, then it's probably not the profession for you, right? So really, I know it sometimes sounds a little woo-woo, but it's important to actually visualize yourself as, for example, if you're like, you know what, I never want to do any procedures. I hate blood. I definitely like get really grossed out by the guts and things like that. I don't want to be on my feet all day. Then you probably don't want to be in surgery, right? So maybe you want to do another aspect of medicine. So it's really important to understand what the actual professional does and the other ones. And the second reason is because when you go on your interviews and in your applications, it's a great way for you to show the program and the admissions committee that you understand what the profession is and you've done your research, and you also can really articulate why you want to be into that specific profession. And then the other thing is to totally get clear on your goals. This kind of ties into the first one, but know what you want in life, and why you want it. So do you want to have a job that allows you to travel a ton? Do you want flexibility? Do you want to work weekends? Do you want to work holidays? Do you not? I mean, there's so many different things, and it's not just about career goals, but it's about family goals, personal life goals, everything. So you want to try and find a career path that truly fits what you want in your life. And then creating a timeline. So this is the more type A Khushbu coming in, but I'm a huge fan of creating a timeline. And so I like to work backwards. So if you know you want to apply to PA school, for example, and the CASA, which is the Common App for PA, I get my application in April, for example, before April. Do you need to have certain courses done? Do you need to have recommendations ready? Do you need to have your shadowing done, your healthcare experience done, and work backwards and create a timeline that way. That way you can truly, stay focused and stay organized and know that you can get everything done and in a timely fashion. All right. Oh, can you guys not hear me okay? Let me see if I can. Give me a thumbs up if you can hear me. I'm just gonna, yeah, okay, cool. All right. So hopefully you guys got that. I know I saw some people couldn't really hear what I was saying, but creating a timeline is really important. And lastly, don't give up. If you truly want something, then it's important to keep trying. And people have tried multiple times to get into their prospective programs, and it's not a big deal. It's very competitive. You guys know that. So if it's truly something that you want, apply again, change up your application, get feedback, whether it's from your advisors or from the actual program, get feedback and take the necessary steps to change up yourself as an applicant and try again. All right, so hopefully that was a little bit helpful. And obviously, if you guys have any questions, you can type that into the chat box and we can get to those later. So I'm going to talk a little bit about my day in the life as a PA in emergency medicine. So I actually worked in emergency medicine back in the Boston area. And then when I moved across the country to San Diego, I've been working in wound care, and I'm actually going back into the ER in like next week, actually. So I'm going to talk a little bit about a case that I had in the ER a couple of months back. But basically in the ER, what I do is I assess, diagnose, and treat patients that come in through the ER. And that could be anything from broken bones, cuts that people get, the laceration repairs, heart attacks, strokes, infections. We saw COVID-19 patients, traumas, foreign bodies. It can be really anything that comes into the ER. So for me, being a PA, we normally, discuss the case with a supervising physician, speak to consultants. So whether it's the primary care physician or a surgeon, if a person has appendicitis, for example, they want to get that appendix out, you need to call the surgeon. If someone's having a stroke, you need to consult neurology or neurosurgery, family members. So a lot of discussion going on in the ER with different people to help with the patient care. Then we decide on a disposition, whether that means, are they going home? Are they going to get admitted to the hospital? Or are they going to be admitted to surgery or a specific specialty? Or are they going to get transferred if, for example, you're working in a hospital that doesn't take, stroke patients, or it's like a level 3 trauma center or something, you might have to transfer them to a place that they can actually take care of whatever the patient has going on. And then, of course, documentation. In wound care, it's a little bit different. Not normally dealing with life or death situations and stabilizing patients. It's more chronic stuff that's going on in the patient. So basically, I actually go ahead and I go to nursing facilities and treat patients that reside in the nursing facilities, whether it's like more acute care or chronic care or long-term care. And I basically assess and treat wounds and other skin conditions that the patient may have, whether it's pressure ulcers, diabetic and vascular wounds, lacerations, post-surgical wounds if someone had surgery and then they weren't able to, they needed more care before they went home, like a rehab center, then they go to the rehab center for a little bit and they get more care from nursing and people like me that round on them. So we basically debride necrotic tissue, do incision and drainages, I replace G-tubes and other skin conditions. And then I want to talk to you guys a little bit about PA's Line before I jump into some cases. So PA's Line is something that I created when I moved to San Diego, like I mentioned. I moved here and I had been working in the ER through the pandemic, and I was a newer graduate and I just felt like I was getting burnt out pretty quickly at a really young age early in my career. And I decided that I wanted to speak with some other PAs in regards to what to do next and just sort of see what other people were feeling. And I couldn't really find a spot to talk to other PAs. So I decided to create networking events for physician assistants. And we basically had virtual events, we have speakers, we talk about like general wellness. I actually have a health and fitness background. I was a spin instructor and a personal trainer back in the day, and super into nutrition. So we kind of connected all together and being a holistic person and just having a positive influence on your own life so you can be a better provider for your patients. So if you want to connect, our networking events are totally open to, they're open to PAs, but they're also open to pre-PA students and other healthcare professionals too. So we do talk a little bit about like tips from getting into PA school and things like that. So if you want to connect, feel free. I have my Instagram and Facebook and blog up here linked. All right, so back to the cases. So case number one, we're going to go through two today. This one is going to be more of a something that I see in wound care, and the next one will be more of an emergency medicine situation, but it'll still have some wound care aspects to it. So case number one, this is a 35-year-old male with history of substance abuse, but no other known medical history. He was admitted to acute nursing facility after 2 weeks in the hospital. And he actually has frostbite on both his lower extremities and left upper extremity. Okay, so I was asked by the nursing staff to see this patient and basically round on his wounds. So his history is that he states he does not recall all the events of what happened, but he said that his girlfriend and him went for a walk after smoking some stuff, didn't really expand on that anymore, didn't really want to expand on it. He said that his girlfriend left him out there and he was found outside after 4 days. He was brought into the hospital and he was taken care of in the hospital. He was now admitted to the nursing facility and he reports decreased sensation in his toes and his left hand. And he reports some pain when bearing weight and he has pain to the touch. So you can see, sorry if the stuff grosses you out, you guys, but here it's just a picture of his hand. I think I have a picture later of his foot, but so this is a picture that you can see kind of what's going on here, and I'll describe what I see in the next slide. So on the exam, you want to generally assess the person too, and he appears comfortable. He looks a little bit tired. When I touch his fingers and his toes, the sensation is definitely decreased compared to other aspects of the body, but it's intact. He can feel me touching him. He has pain when I touch. I assess the pulses on his feet, on his upper extremities, and they're all intact. That's really important to make sure that there is good blood flow going to the extremities. The left hand wound, which is we're going to focus on the left hand, measures 3.6 centimeters by 3.3 centimeters, and the depth is undetermined because if you can see my mouth, if you see the black eschar over here, you can't really tell how deep that is. So we're going to say the depth is undetermined. There's moderate to sanguineous drainage. There's a mild odor, but no real sign of infection. And that's important when assessing wounds and other skin conditions as well.
But I told you, don't tell Julie I gave it to you.
If everyone can just go on mute, just getting some feedback from other people.
Yeah, she doesn't even like it because.
So there's no sign of infection. That's really important to assess any skin conditions or wounds, right? We don't see any redness around here, around the finger. There's no warmth. There's no super purulent drainage or anything like that. So that's a good thing. And for the breakup of the actual wound bed, we see 60% eschar, which is this black here. Okay, this is the black. I don't know if you can see my mouth, but hopefully you can see that I'm talking about the black stuff. That's eschar. Sorry, and then there's 20% yellow fluff, which is kind of, you can see the yellow fluffy kind of area, especially on the palmar side here. And then there is 15% granulation tissue and 5% epithelial. So the granulation tissue is kind of that red, and that's actually what you want to see. That's healthy tissue. So that's hiding under there somewhere, but that's what you want to see. That's indicative of wound healing and good healthy tissue. And then the epithelial is basically just kind of in between the areas that is closed up the wound, and that is all healed. Okay, so frostbite. Basically, I want to tell you a little bit about frostbite. Hopefully you guys have heard of it. Hopefully you've never had it, but it's a cold injury. And the reason it basically you get all this dead tissue is because of vasoconstriction. So the cold actually causes vasoconstriction or tightening of those vessels. And it's kind of twofold. One is because your fingers, your toes, your nose, everything is more distal, right? Further away from you. And you have vital organs that are proximal, or like in your, like your heart and your intestines and everything. These are all, I guess, more proximal. So your body is trying to basically constrict all the vessels distally so that the blood flow can actually continue to flow to those vital organs to keep you alive. So that's one of the reasons that you can get the death of tissue in your fingers and your toes and your nose and things like that. But also you get vasoconstriction for other reasons as well, which I'll explain. So you get ice crystals that form extra and intracellularly. And then all of this ends up basically causing like a cascade of like inflammatory markers as you rewarm, but that ends up leading to thrombosis or basically clotting. And that is what also impedes blood flow from getting to the distal parts of your body, so like your fingers and things like that, leads to ischemia. So ischemia is lack of blood flow or no blood flow, like a myocardial infarction. That's ischemia to your heart muscle, and that leads to tissue death. And so that is one aspect of what's going on. Number two is actually when you're reperfusing and rewarming the fingers. So for example, when they found this patient and they brought him back to the hospital and they gave him a warm water bath and started warming up his body, as you do that, there's an inflammatory response there. And from there, you get platelets that aggregate and inflammatory markers that are going rampant everywhere. And that also leads to thrombosis. So think about like when you get a cut and you get a scab over it, right? That's basically like a scab that's all inflammatory markers and platelets aggregating. That also happens and leads to further tissue death. So it's really important that you do not classify the stage of frostbite until after rewarming, because you might have further damage later. Hopefully that makes sense. So here are the stages here. You can see that there's first degree, second degree, third degree, fourth degree, kind of similar to how we stage burns, if you're familiar with that. So the first degree is superficial, so is second degree. Basically, in the first degree, you get freezing, but there's no like blister or anything like that. You might have a little bit of peeling on the epithelial surface. Second degree is a little bit deeper into that epidermis, and you can see the reds there. Still superficial, however, and you could get a blister formation, but it's going to be clear fluid filled. Third degree and fourth degree are a lot deeper. You're entering that dermis and even subcutaneous tissue into the fourth degree. So you can, at third degree is when you can start getting that tissue death or gangrene. You start seeing that black extra that I showed you in that picture. If you have a blister, it would be blood filled because you're deeper, and you can kind of see in this picture, this is like where all the vessels are. So once you get deeper, you get blood in the blister. And then fourth degree is full thickness. You're getting all the way through into that subcutaneous tissue, into that bone, into that muscle. All right, so poll number 3, what stage of frostbite is this? Is it stage 1, stage 2, stage 3, or unstageable? 3, you guys got it, yeah. 3, perfect. It is post-warming, yes. It's not a trick question, it's post-warming. Stage 3, you guys, awesome. Yeah, so the person that said it seems like multiple stages, good point, but we go by what the deepest layer is. So even if there's aspects of more superficial damage, you wanna go by what the deepest is for that particular area. Awesome job, guys. All right, so when can you stage frostbite? Is it after rewarming, prior to rewarming, 7 to 10 days after injury, or as soon as it is first examined? Yeah, you guys are paying attention. After rewarming, perfect, amazing, right? And that's because we can see some more damage technically after rewarming, where you get some more thrombosis and inflammatory cascade. And you can see that's why it's really important to wait until after rewarming. Beautiful. All right, so what do we do for the treatment of this patient, treatment and plan? So one, you want to make sure that his tetanus is updated, and that was updated at the hospital. You know, he was rewarmed, he was given antibiotics to prevent infection, thrombolytics to help break up some of that clotting. Pain control is really important because this can be very painful, especially after rewarming. And then surgery was consulted, wound care was consulted, which is us. And from there, on a wound care perspective, we're going to be working on debriding that necrotic skin. So you can see in the photos here, this picture was actually taken of me today while I was at work. And I'm debriding some of the skin off of this feet. We've come a really long way. So I use what's called a charrette, and basically work on pulling back some of that eschar that you see and taking it off so that the healthy tissue can come up. But you can actually look in this picture, you see the red underneath here, that's granulation tissue, and that's important, right? That's indicative of healthy skin. Healthy tissue. So this black stuff, the eschar, is what we want to get off eventually. So to remove necrotic skin, we prevent and assess for signs of infection. So like I mentioned, it's important that, infections, if you need antibiotics or anything like that, we want to make sure the wounds are staying as clean as possible. And then we promote and support healthy tissue growth and healing. So doing things like debriding, using different topicals, keeping things wrapped, and just making sure that we're giving his body the best chance to recover. All right, so what is the sign of wound healing and healthy tissue? Is it black, thick eschar? Is it B, yellow stringy fluff? Is it C, BC red granulation tissue? Or D, easily bleeding and peeling epithelial tissue? Awesome, you guys got it. It's BC red granulation tissue, amazing. Nice job, you guys. Perfect. All right, so if anyone has any questions about that stuff, please feel free to type into the chat box and we'll get to them. We'll go ahead and move on to the next case. And yeah, all right, so case number 2. This one is something I actually had in the ER a few months back, and it's still kind of related to wound care. So hopefully you get a little bit of both, but it's gonna be more from the emergency medicine perspective to give you that difference. This is a 43-year-old right-hand dominant female mechanic, and she presented to the ED with injury to the right hand while she was at work. So her history, she states that she was throwing out the trash, and when a lid of the trash container, like those massive containers, the dumpster, basically slammed shut on her fingers. So she reports pain, bleeding, and states that she cannot move her 3rd and 4th fingers because they're super painful. And she has a history of hypertension, high blood pressure, and GERD, which is reflux. All right, so these are the pictures. You can see the 2nd and 3rd digits here. Got quite traumatized. So the exam, again, so from an emergency medicine perspective, we always want to assess whether this patient is sick or not sick, okay? And what I mean by that is it life-threatening right now, or is it not? So right now, she has pain, but she's comfortable, okay? She's not gonna like go into cardiac arrest or anything right at this moment. So she's in no acute distress. She's uncomfortable, but she's in no acute distress, okay? She's her right hand, her right 3rd and 4th digits have a laceration. There's some maceration distally. So maceration is kind of this like, you can see the laceration. Maceration is more like fragile skin, okay? It's kind of like what that looks like. So just flipping back here, that's like kind of the maceration here. Distally, it's proximal to the nail bed. So there's some bruising, there's oozing of blood, but it's controlling, like she's not like actively bleeding out. And there's also subungual hematoma. So you can see, so I just saw your question here. So laceration, there is, you can't really tell, but there was some deeper sort of cuts here. Maceration is more like when the tissue is really fragile, and if I tried to suture it, it wouldn't stay. It would just like cut. So like over here, you can't really tell in these pictures, but there's a deeper cut that actually needed laceration repair where I sutured it. But some of the skin here is too fragile, it's more macerated. So if I tried to suture it, it would just rip the skin. Hopefully that makes sense. And then there's a subungual hematoma, which is over here on the nail bed. And then the 3rd digit with a mallet finger deformity. So that is flipping back here. So if you look at your fingers, they're not really supposed to bend like that, okay? And I'll explain mine a little bit. The 4th digit has no sign of tendinous injury, and then distal sensation is intact. Radial and ulnar pulses are intact. All right, so how many X-rays do we need? None, 1, 2 or more, no, we need an MRI. What do you guys think? I'm getting a good range here, but I see a lot of C's, I see some B's, I see some A's. No one's voting for MRI though, huh? Good, awesome. We don't need an MRI, but we do need X-rays, and we need 2 or more. So basically, anytime you get an X-ray of anything, you guys, you need to have at least 2 views. Reason for that is that we are 3-dimensional beings. X-rays give you a 2D image. So you need to get at least 2 views, 2 different angles. If you don't, you might miss a fracture, okay? So I'm only showing you 1 view, of course, but it's because you can obviously see the fracture here. But basically, the thing is, this is 2-dimensional, and you can imagine that if the fracture was more on the lateral aspect and medial aspect, or if it was straight through, you could barely see it, then you might miss it, right? So you have to get another angle from the side or from an oblique view or something, so that way you can actually see all sides of the 3-dimensional hand and not just 1 view. That's why it's important to get 2 or more. Excuse me. So we got an extra to the right hand. We actually got a oblique lateral PA as well, to see all the different views. And so this is a distal tuft fracture or a phalanx fracture, and she actually has them to both her 3rd and 4th digits. So you can see that up here. You can see the breaks here. Quite painful. So treatment and plan. So there's a couple of things here that we need to address. So one is open fracture and the tendon injury. So I actually started the patient on IV antibiotics and gave her a prescription to take home until she followed up with a hand surgeon. We did go ahead and splint the fingers as well and an extension. So the tendon injury that I want to tell you guys about, so the mallet finger, which let me just scroll back here. Oops, wrong way, my bad. So the mallet finger right here, how it's bent in that way. There is a tendon that basically runs up top here, connecting like the distal phalanx here. And if that tendon is compromised or sprained or basically cut in any way, then your finger cannot stay fully extended. Okay, so I don't know if you guys can see me in this picture, but that's the only way your finger is going to bend like that. So the tendon helps keep it straight. So if it's broken, it's going to bend like that. So it's important for us to splint it in extension and then also buddy tape the fingers together. I actually buddy taped all 3 fingers, the 2nd, 3rd, and 4th together, because she had the break in both the 3rd and 4th digits. So splinting and buddy tape is fine, and extension, and then she needs to follow up with hand surgery, right? She's right hand dominant. It's really important for her to follow up. She's a mechanic, she uses her hands. So I actually called the hand surgeon, and they also sort of like, I told them my plan and they agreed, and she's gonna follow up. For the laceration that we talked about, she did have some laceration there, so I couldn't really lacerate, I couldn't repair all of it, but I did my best to clean up the wounds really thoroughly, updated her tetanus. She literally caught her fingers in the disgusting dumpster. So important to really clean it out, give some pain control, repair the wounds. And then the subungual hematoma, I actually did trepanate, just one of them. I'll go back to the picture. It was actually the 4th digit that I trepanated. This one, the 3rd digit isn't as much. The rule of thumb is once you get to like halfway of bruising or the hematoma, you want to go ahead and trepanate it, which means basically put a little hole in the nail. You can see up here. I use electrocautery to put a hole in and expel out the blood. So that actually causes quite a bit of relief if you've ever gotten your finger slammed in a car door. Hurts a lot, but once you get that blood out, it relieves a lot of the pressure. All right, so why did we give this patient antibiotics? Is it A, to prevent tetanus? Is it B, because she injured her dominant hand? Is it C, because it's an open fracture, we need to prevent infection? Or is it D, because she has hypertension and is immunocompromised? You guys are good. Amazing. Yes, it is C. So technically that is an open fracture because she has a laceration and she also broke it. Perfect. Good work. All right. And also if you have any other questions on that, feel free to type them into the chat box and hopefully we can address them. I know that was a lot of information, but I think you guys can handle it. And then last poll here, as a pre-health student, I take time to do things that I enjoy. Never, once per month, a few times per week, or daily. A few times per week, I see some dailies, I see once per month. Okay, good. C or B. Nice. Awesome. So the reason I threw this poll in there is because I am a huge advocate of having a lot of fun. I think it's so important to, yes, I can only imagine I can't do things myself because I got two newborns. Yes, fair enough. So it is a hard profession that just medicine is a lot, right? There's a lot going on. It can be very stressful, can be overwhelming. Getting into these programs can be very overwhelming, especially when you have two newborns, but especially with just life in general. So it is important to do things for yourself, whether it's just getting outside, whether it's binging Netflix here and there. Work for me, it's just moving my body, getting a sweat in, even if I just go for a walk, getting good sleep. And I know that sounds really ridiculous sometimes when you're so busy, but it is so important. And you want to try and develop those habits earlier, so that way, when you're busy in your careers, you have them already developed. So that's kind of why I also started PA's Align. Is I'm a huge advocate for just doing things that you enjoy and living a fulfilled life, so that you can actually go ahead and be a better person for your patients. So totally helpful. All right, so I just want to tag some of my resources for my pictures and things, and then I want to leave room for questions. I see one here. How many patients do you see on an average per day? So that totally depends. In wound care, I see anywhere at one facility, I see anywhere from like 20 to 30 in a day, and it's quick. Like, we're doing rounds really quickly. And then in the ER, it's a little bit different. Totally depends. On average, I would say like 10 to 15, because there's a lot more involved in the ER setting. Okay, what else do I see here? So the people that are kind of running this, like Susan and Jesus, should I just read through the chat? Is that what you want me to do, or do you have already questions that you've written down, or how do you want me to do it?
Yeah, so throughout the whole Zoom session, we did record the questions that came up a little bit earlier during the session, and we do have them on a Google Docs. So I'll just hand the mic over to Jesus, and he'll start asking the questions. So Jesus,
Okay,
whenever you're ready.
Perfect. Stop sharing my screen. And then I can answer some more questions that are coming up while he's getting his Google Doc. But in the ED, how do you determine who is seen by the PA and who is by a physician? So that's a good question. It totally depends on the ER. The ER that I worked in back in Massachusetts, it was fair game for anyone to see anyone. We would just sign up for the patient as they came onto the board, and then the physician would also sign up for them. So all my patients were at least discussed with a physician. Some of the more simple cases, like an ankle sprain, the physician didn't necessarily see them or anything, but if there's anything a little bit more, demanding or like more acute, then the physician would get involved. So it didn't really matter. Then I hear that the AAPA voted to change the name for a PA from assistant to associate. Yes, I did. I think it's awesome, actually. I think that, way back in the day, we were called physician associate, and I think it's really cool to be able to have this name change, because I think it kind of just defines our scope a little bit better than just being an assistant. However, I do think it's going to be a little bit confusing for patients over the next couple of years. I already find it difficult to explain what I do sometimes to some people. People are like, wait, so are you my nurse? I'm like, no, I'm your PA. They're like, okay, so you're the doctor. I'm like, no, I'm your PA. Like, so sometimes that can be a little bit tough. So I'm sure adding physician associate now is going to just make that a little bit more challenging, but it's all good.
Okay. I'm sorry. Thank you so much for answering my questions. Okay, so we're back. So some of our questions that we have over here. So Nikki says, I am currently studying to become a PA, but I was thinking of taking a gap year to fulfill my hours. Do you think it looks bad and or worsens your chances to get accepted into PA schools by taking a gap year?
Good question. I don't think that it worsens your chances at all to take a gap year. especially if you're using the gap year to further your experience, especially in patient care and healthcare experience. Actually, physician assistants or physician associates. So PA programs really, a lot of programs require at least like 1,000 to 2,000 hours plus of patient care experience. So if you are taking that time to get that experience, then amazing, you have a reason for it. Okay, so I don't think it's ever a bad idea to take a gap year. In fact, I think it's really important because you will be able to really delve into the profession a little bit more and into the field and have a good like insight into what it's really like in different professions.
Okay, wonderful. So I think this is a really interesting question, actually. So another audience member asks, have you always been comfortable around such wounds, or is it built on by experience?
It's such a good question. I don't know. I think that I just like slowly got used to it, but I think it's both. It's pretty gross, and sometimes it smells really bad. So I have to be honest. But it's like when you're the person that's taking care of the patient, like, and you know that you need to like suck it up and just do it, then I feel like something comes over you, or at least for me, and you just like go ahead and do it. With that being said, it's so funny. Like if I saw an ant right now, I'd probably have to like leave the room and just like, sorry guys, like you can't do this until the ant is removed from the vicinity. So I see bugs and I freak out, and there's nothing I can do, but I can do all this sort of wound care. And my husband totally calls me out on every time I ask him to kill a bug. So I think that it's a little bit of both. I think like you need to have the stomach for it, but you also just like, you know that you're in that role and you just have to suck it up.
Okay, food for thought, definitely. So what does your schedule look like on a regular day as a PA?
So it kind of depends on where I'm working. So today was wound care day. So I basically I do one facility on Tuesdays, and I basically went this morning. We started at 8 o'clock rounds, met with the wound care team at the facility, which is made up of a CNA and 2 nurses. And we basically just round from patient to patient, do the treatment that we need to do. I think we saw about 26 today, 26 patients, but I was back and home in time with, I dictate as I go after each patient, and I have paper charts. The physician that I work for, he actually owns the company that I work for, and he makes it really easy for us to do all our charting. So I was able to pretty much get it done before I even got home, which is so nice. So I can just focus on this presentation and I can relax after for a little bit. For emergency medicine, it's a little bit different. They're usually a lot longer days. I haven't started my ER job here in San Diego yet. That's starting next week. So when I was working back in Massachusetts, it was, it would be different shifts. It varies. There were 10-hour shifts or 12-hour shifts, sometimes 8 if they're overnight. And when you're there, it's really just you're constantly going. It's constant because there's always patients coming into the ER. And you're managing a bunch of patients at the same time. But once I go home, I also was a big advocate of finishing my charting before I went home, so I did not worry about any of my charts when I got there. Otherwise, they just pile up. And when I get home, I don't want to think about medicine. I just want to do other things. Hopefully that helps.
Okay, that is definitely, sounds very busy for sure. Okay, so another question regarding that same line of your work. Oh, sorry, give me a second. Okay, so you mentioned that you do work with, of course, physicians, but how closely do you work with physicians? And does it, vary depending on the specialty of PA?
Yeah, that's a really great question. It totally varies on the specialty, and it totally varies on your supervising physician as well. And it varies on your comfort level as a PA. So for me, in the ER, I was a new graduate going into the ER. I totally felt like I had no idea what was going on. I felt like my 2 years of PA school, I was like, what did I even learn? Did I learn anything? I don't think so. Like, it was how it felt going in. So totally utilized my supervising positions a lot more than I do now. And that's normal. But I have to say, every time there's at least one thing that is brand new, or I'm not sure what to do, and it's totally okay to reach out to a colleague or your supervising physician to talk it through. So in the ER, I definitely worked a little bit more closer with my supervising physician, just because things would come up. And at the hospital that I worked at, they actually required that we, as PAs or nurse practitioners, did at least talk through our case with the supervising physician. So I just had to work naturally closer with them. But with wound care, I am the only person that goes there, as my supervising physician doesn't go with me. So if I have a question, he's readily available over FaceTime or over the phone or over text. So, I'll just quickly FaceTime him. Like today, I had this G tube that I was trying to change, and it wasn't working the way that I planned, and it was a mess. So I FaceTimed him, and I was like, this is happening. Like, what do you think? Like, is this what I think it is? And he's like, yes, like, you're right. Send the patient to the hospital, kind of thing. So it's nice to have that, that accessibility, but it's definitely a little bit more autonomous in wound care than it is in emergency medicine, for me at least.
Okay, thank you so much. So another question that I find quite interesting is, like, in the ED, how do you determine who is seen by the PA and who is seen by a physician?
Yeah, that's a really good question. Again, totally depends on the facility that you're in. Some ERs actually have PAs and NPs work in like the fast track, where they're kind of just separated. So like the fast track is like laceration, more like urgent care things that aren't necessarily patients that will get admitted to the hospital or transferred out. Like a broken bone or a sprained ankle or INDs, like skin stuff. So kind of more simple, like urgent care type cases. So sometimes the way that the ED is organized is like that, but sometimes it's not. So the one that I worked at in Massachusetts, it was like a free-for-all. So anyone that came in through the ER, any of us could sign up for the patient. So I was really allowed to see anyone that I wanted. And the reason for that is because it's required that I at least discuss the case with a supervising physician. So you can imagine that in an ER where there isn't that rule, where the PA only has to, can see the patient on their own, and only if they want to discuss the case, they can, then they might be more apt to maybe be held to like certain levels of cases or be more in the fast track setting. Hopefully that answers your question.
Okay, thank you so much. So what advantages are there when pursuing a physician associate degree versus a medical degree, on your opinion?
In my opinion, again, this is all opinion based, right? And it totally depends on what you want. When I go back to my tips, based on what you want for your goals and where you see your life in the actual profession. So for me, I wanted more flexibility. Not saying that you can't necessarily have that as a physician, but I wanted more flexibility. To be honest with you, I didn't want to go through 4 years of school and then a residency and then potentially a fellowship. I love being a student. I really, really do, but I just did not want to do it for that long. I also, when I shadowed a PA, I actually shadowed a bunch of PAs and I shadowed a bunch of physicians. I just felt more connected with the PAs and what they were doing. I felt like their roles were very similar in many ways, but I saw myself in the PA role, and I didn't necessarily always see myself in the physician role. I also knew that I didn't want to be a surgeon, and I was okay with being a first assist, and I was okay with doing a non-surgical specialty as long as it had some procedural aspects to my job. And I knew I could get that from being a PA and not necessarily a physician. So all that stuff tied into what made me choose this route. again, that doesn't mean that that's the route for you. It's really important that you think about what you want in your life and make sure it aligns with the profession that you choose.
Oh, I definitely agree. It's definitely a process of great introspection and working hard on getting to know yourself and what moves you to help other people. So Catherine asks, where do you see the PA profession in the next few years?
Where do I see it going in the next year?
Yes.
1 year. I mean, I hope that it continues to grow, and I hope that people, like the general public and our patients, are more aware of what we do. And I think that with the name change, actually, we're going to be getting a little bit more light shed on our profession, which is a great thing. Yeah, so I think that, and it's hard with the PA profession. It kind of varies. I don't know if you guys are super familiar with like the legislation pieces and like the politics, I guess, of the profession, but it also varies state to state on what you're allowed to do as a PA and what your scope of practice is. So your scope of practice is always defined by your supervising physician, but in different states, there's different laws for what you can do. I'm hoping that there can be more of a consistent feel throughout the whole country and throughout the world. That would be an ideal situation. So that way we have more flexibility to move within states and things like that. But I think that will also help our patients to really understand what we're capable of doing, what we're allowed to do, and what our scope of practice is. So I know that's not really answering exactly where I see it going, but I can at least answer where I hope to see it going.
Okay, that is definitely great. Okay, so you did mention that your scope of practice is greatly determined by your supervisor physician. I'm really sorry. But did you need to do any type of residency to specialize in wound care or and emergency medicine or on the job training?
Yeah, that's a really good question. There's definitely residencies available, especially in specialties like emergency medicine, and ICU and surgery, things like that, things that are very specialized. You can do a residency and you can choose to do one if you like, but they are not mandatory by any means. So I considered doing a residency in emergency medicine when I got out of PA school, because I felt, like I told you guys before, you finish PA school and you're like, did I even go to school? Like, it's a lot of information in such a short period of time. And book of medicine is definitely different than clinical medicine in some ways. So I definitely considered doing a residency. I started to apply, but then I ended up getting the job at the ER. And the thing is that to be completely frank, a lot of employers know that if they know that you're a new graduate, then they know that you don't have much experience. And as long as they know that and you're clear with them that you need training and you inquire about the orientation process, and they know that they need to train you. And honestly, a lot of it is on the job training and education. So it just worked out that I got a job that was willing to take a new graduate and teach. I almost kind of felt like a resident. Like I worked with a lot of, obviously I had my own patients and stuff, but the way that I worked with a lot of the physicians was a lot, in many ways, similar to a way that the medical residents tended to work with them. So it worked out for me, kind of a win-win, right? Like I didn't have to work like the residency hours and then get the residency pay. I got the best of both worlds, where I got a PA salary and was able to be trained.
Okay, thank you so much for your answer. Considering that you already talked to us about a little bit about how your schedule looks like, right? One of our audience members asked, do you think that it's a myth that PAs have a good work-life balance?
That's such a good question. I love that. I think it's a myth in some ways, because like when you're in medicine because you truly want to help your patient, I hope. And like it's hard to create those boundaries sometimes, because, so it's a twofold answer, yes and no. It's not a myth in the fact no, sorry, it is a myth in the fact that if you want to create a better work-life balance for yourself, you can. Okay, it's not impossible. You completely can. And that's why I think it's important to prioritize what's important to you and make sure that you always take time for yourself and do the things that you love. But yes, it can be, it's also not a myth, because if you're in a specialty that just demands a lot of you, demands a lot of hours, and you chose a specialty or a field where you have to completely be immersed and you need to be on call and things like that, then you might not have a good work-life balance. So you can decide to go a different route if you like, but at the same time, if you don't, then you might not have that great work-life balance, if that makes sense. But I think that it is flexible in the sense that you can sort of choose the path you want to go into. So for me, I can't just always be doing medicine. I don't think I would be a good PA if I only did medicine. I need to be doing other things. So I make sure that I prioritize other things in my life. So I feel like I have a pretty good general balance, but not everyone does, because maybe they don't want it.
Okay, so along that same line, do you have any suggestions or further comments on how to balance work and other aspects of your life?
Yeah, I do. I think that having a calendar has really saved me. All my work schedules in the calendar. I also schedule in my workouts. I schedule in time, date nights. I schedule in time with family. Obviously, we're starting to schedule those things in a little bit more of recently, but like, I'm a huge planner and I need to have my calendar. So I think putting things in my calendar definitely makes it apparent that I need to do them, and that helps me just to do other things other than just work. So that's how I for sure get other things into my life, but you might have other ideas for yourself.
Okay, everyone, so you heard it here. Try to get your calendar set first. So another member of our audience asks, is it true that getting into PA school can be more difficult than getting into med school?
It's definitely very competitive, and so is medical school. I've heard that somewhere, but I'm not really sure where that fact comes from. I don't know if there's an actual statistic of number of applicants to how many people are accepted. If there is, I don't know it, so I can't really truthfully answer the question. But all I know is that they're both very competitive, and you need to be a good, well-rounded candidate for both fields and both professions.
Okay, thank you. So this question is more regarding your work. So how many facilities do you go to each day in wound care?
Totally depends. So I work for a company, and he's actually, the owner is a physician, and so he actually has like a bunch of facilities that the company goes to all over California. So I live in San Diego, so I would only go to the facilities in San Diego. And he's like just getting started in the area. So right now I see one, but we see a ton of patients in that facility. But it can depend. I can see up to 2, 3, but they're spread out through different days. So for now, for me, I go to one because it takes up a good majority of the morning / into the afternoon. But if there's like fresh patients, so for example, like I know a couple other providers see patients in LA, and they see like 4 or 5 facilities in one day, but that's because they have like, 5 patients at the first facility and maybe like 3 at the next one and 10 at the next one. So it ends up being still a similar number of patients that I might see at one facility. It just totally depends.
Okay, for sure. So did you encounter any surprising challenges that came with patient relationships?
With patient relationships?
Yes.
I'm not sure exactly what that question is, but I'm going to sort of answer it based on my interpretation. So I think like there's definitely been times when I can think of one time in particular where the patient just did not want to see a PA for whatever reason. And that's fine. It is what it is. I mean, I explained that, I work with the doctors and, basically like if they have any questions or if they want to see the physician, that's totally cool with me. You know, I'm not sure if he was in the ER, so whatever the reason may have been, he didn't want to see a PA. So I just told the nurse, I was like, he doesn't want to see me, I'll just tell the physician, like they can go in there. So that's kind of tough, but I just, you know, at first I was like a little offended, but then after that, I was like, okay, it's not even about me. It's not a big deal. At the end of the day, it's about him. Like you know, the doctor that I was working with was like, I'm so sorry this happened. I'm like, I don't even care. It's all good. There's plenty of patients here that want to be seen by me. So I'll just go see them. But whatever it may be, sometimes, you know, I think that being a woman, and, you know, especially if you're like a woman of color, like some people just assume that you're a nurse or you're not, you know, like a provider or whatever it may be. That can be tough. But again, I just tell them who I am, introduce myself, and I just do my thing. So those are some of the, I guess, difficult relationships I've had or instances that I've had, but nothing that we can't handle.
Okay. I think this is a really good question. So in your opinion, what specific traits does a great PA possess?
So, I just want to add in, and when I say that, like when people just assume I'm a nurse, I'm not by any means like, you know, saying that the nursing profession is not a good one. Like my life would suck without nurses. So I respect the heck out of nurses, and I just want to say that real quick. But anyway, and I was a CNA before I went to PA school, so totally respect the field, and it's so necessary. And sometimes nurses know more than we all do. So anyway, so I'm going to answer your question. Remind me what the question was. Oh, qualities that a PA should possess. Okay. So communication skills, number one, I think that is in general for any profession, actually. Communication skills, but especially as a PA, because sometimes, you know, I know people don't necessarily like using like the word mid-level provider, but in a sense, you are sometimes the liaison between like nurses and medical assistants and technicians and phlebotomists and the physician and to the patient. So I think that communication is huge. Not only are you communicating with your supervising physician, you're also communicating with consultants, so, and the patient and the family. So it's a lot of communication. I think that's huge. Number two is being patient. I think being patient not only with your patient, but with yourself and the other professionals that you work with. And then let's see, I think, the third one I would say is, and there's so many more, but I'm just gonna say one more, is basically being confident, but humble at the same time. And I think that goes for all aspects of medicine. There's so, you know, it's hard because a lot of medicine is pattern recognition, and you kind of like get into the zone and you're like, I've seen this before, I know what this is. But it's also so easy to become overconfident and then miss something that you just assumed was something else, and it was something else that you didn't possibly treat the right way because you weren't humble enough to understand that, hey, sometimes I can be wrong, and I need to be more open-minded. So I think it's kind of a mix of all four of those things.
Okay, wonderful. So I have two questions that are sort of like follow-up of each other from two different audience members. So I'm gonna ask the first one, and then I'm gonna ask the second one, so you can, like, you know, try to make sense of them. So the first one is, how common are travel PAs? And the second one following that one is, can PAs practice in the same countries as MDs?
So travel PAs, I've never been a travel PA, but I know it's a thing. There's also things like locum tenens and different organizations that like need temporary PAs, so you can actually like travel to those sites and work where PAs are needed. So similar to travel nursing, I know that out there for PAs, but I, to be honest, don't know much about it because I have never done it, but I know it's out there. And then in terms of, can PAs work in the same country as physicians? I'm not really sure what that question means. Like, do you mean maybe like if a physician was to work in another country, like could I then also go ahead and work in another country? Maybe is the question. I don't know the answer to that. I would think in my head possibly, because I've heard of PAs like, you know, going overseas and doing like medical mission trips and stuff. So I have to assume, and I'm assuming that it's possible as long as you have a supervising physician that is also eligible to go in another country. Because again, going, and this is me kind of speculating a little bit, so I'm sorry if I'm wrong, but our scope of practice as a PA is literally defined by our physician scope of practice. So in that sense, I would say I think it's okay.
Okay, wonderful. So it would be a little bit of like a team effort sort of thing.
Yeah, I think so. And I could be totally wrong. I can try and find out, but I know I've seen like, I know I've heard of PAs going abroad and doing like mission trips and stuff. So I know it's okay. I know it's possible.
Thank you so much. So another question is, how did you choose your specialty? Like, did you always know that you wanted to go into emergency medicine, or was it like a back and forth in PA school? How did you choose it?
Yeah, so I actually, I was a medical scribe after I finished undergrad. And when I became a medical scribe and I worked in the ER, and I just loved it there. I just loved it so much. I thought it was so cool how like random things were coming through the door. I loved the pace of it. I also loved that like the lifestyle in general too, like how when you're at work, but then when you go home, you don't really have to be at work anymore. I like that part of it as well. And so I kind of knew from being a medical scribe that I liked emergency medicine. And then when I went to PA school, I, you know, doing rotations through different specialties, I was like, oh, wow, like I love ortho, because I've also had a bunch of knee surgeries, and as being a young, in like middle school, I started having knee surgeries like through playing sports. So I was very familiar with the ortho field, and I was like, hey, I know all this stuff because I know what these patients are going through, and I felt connected to that as well. So I like that, and I like dermatology, and I hated dermatology in didactic year, like learning about it like through books and stuff, like I hated it. But when I was actually in my rotation in dermatology, I was like, this is sick, this is amazing, I could do this. So it was funny, like I felt like there's a lot of things that came up that I thought I liked, but emergency medicine was always kind of in the back of my head because I liked it when I was before I even started, and I felt like it was a good thing to go into right away because it's so broad. And being a new PA, a new graduate, I think that if you're not 100% sure that you want to go into this particular specialty, then do something more broad, like primary care or emergency or general surgery, rather than like, hey, I'll just get this random job in a super specialized field. So that also kind of took part in what I wanted to do.
Okay, wonderful. So a common asked question in our chat is, how did you study and prep for the GRE exam?
I took the GRE before PA school, right? Yeah, it was a prerequisite. Oh my God, I don't even know where my mind is. So I took the GRE. What I did is how I prepped for it was I ended up getting like a Kaplan book, and if I'm not mistaken, you guys offer discounts to students, right? Through Kaplan, which is really cool. I recommend getting like one of the Kaplan books, or it doesn't have to be Kaplan, it can be any of the other, there's like, I think Christian Review and some other ones. I got a book and I just allocated time every day, at least 30 minutes to an hour to just do practice exams. From what I remember, I'm sorry, it was a while ago that I took the GRE, but it reminded me of like an adult version of the SAT, which the SAT, I hate those kind of things, but like something that you just have to do. So I got the book, I went through it, I took practice tests like every day, at least a 30-minute one, maybe an hour one, and I just did all those and I went over the questions. The thing is with PA schools, like obviously you shouldn't like fail the GRE, but you also don't have to do like phenomenal, like just do generally well. And because there's so many pieces of your application that also matter. So like if you're like, oh God, the GRE is like sounds like a black cloud over my head, like just put some time into it every day. A little bit every day goes a long way. And don't stress too much. Focus on the parts of your application that you also can control is my advice.
Thank you so much for that advice. So another member of our audience, I'm sorry, asks, have you thought about changing specialties later on in case you experience burnout in your current specialty? And if you do, how would be the process of changing specialties in the PA profession?
Yeah, that's a really good question. And honestly, I have thought about it. When I first moved out to San Diego, I thought about going into a different specialty. You know, I was tired of the ER, and I didn't realize how tired I was until I got here and I wasn't working in the ER right away. But now I miss it dearly. So, but I was thinking about switching specialties, and that's actually how I got into wound care. I figured it would be a cool way to at least keep up some procedural skills and do something different while I was getting back into the ER. But I think that as a PA, like, it's not easy by any means to just switch specialties, but it's doable, especially if you have background in more of a broad field. So, you know, having emergency medicine as a background for me is great, because in the ER, I saw things, you know, I could go into ortho because I've seen a decent amount of ortho stuff. I could go into cardiology if I wanted, because I've seen a decent amount of cardiology things. So, you know, it is nice to have, like, you know, if you're in primary care or you're a hospitalist or something where you saw a broader range of a lot of things, I think it's easier to hone in on something and specialize later. So I think that gives you a little bit of like an advantage in switching specialties. So it's not impossible, okay? And a lot of jobs, when you're looking to apply, they say like, hey, you need at least X number of years of experience, but a lot of times it's not in that particular field. Sometimes it is, but it's not really. It's just you need X number of years of experience as a PA or whatever. Because like I mentioned before, so much of our job is on the job training and really learning kind of like how that physician or how that group practices and what they want you to add to that group. So definitely not impossible. Yes, it can be hard depending on the specialty, but it's doable.
Okay, wonderful. So another question, and I think this one's really interesting. So do PAs have to be certified in each state, and would they have to get recertified if they move to a different state and come back?
Yeah, so yes, you have to have a national certification, and you also have to have a specialty like through the board of your own state. So when I first graduated PA school, I got certified in Massachusetts. And then when I moved to California, I had to get certified in California. In Massachusetts, it just depends. It depends on each state. But Massachusetts, for example, the certification lasts for 3 years or 2 years. 2 years? I don't know. I forget. 2 or 3 years. So I think mine just expired. I could have renewed it if I wanted to. It's literally as simple as like paying another fee. And then just making sure that like your, I think they just like check to make sure you had like no like issues or anything with your license. And so you can you can just keep up your certification if you know you're going to move back. But for now, I'm like, it's not worth it because I don't think I'm going to move back in the next 2 years. Potentially in the future I will, so I can get recertified in Massachusetts. But right now, but for a while there, I had a license in both California and Massachusetts, but the Massachusetts one expired, and now I just have it in California. But with all of that, in order to get certified in your state, you have to keep up with your national certification, which basically tracks like your CME hours, your education hours, and that's really it. Just making sure that you're keeping up with your education to renew that, and then you have to like retake the exam, the PAN. It's called PANRE, and you take it. It's now 10 years, so you have to make sure you're keeping up with that as well.
Okay, thank you so much for that valuable information. I'm pretty sure lots of students definitely will benefit from that. So for our final question, and getting ready to wrap up. What tips would you give a high school student that wants to go into med or PA school?
What advice would I give to a high school student? Ooh, high school. Okay. So for a high school student, I would say, I think this is like the same advice I've been giving this whole time, is just really take a deep look into what you want your life to look like in 5 years, and then again in 10 years. And if that's too much, take a look at what you want your life to look like in 2 years, and then 5 years, and visualize it. And I say that because I think that's going to really help make you decide on what you want to go into. You know, if you look at your life in 5 years and you're a senior in high school and you're like, there is no way I want to do med school in 5 years or ever, then like, why are you even considering medicine? Like, you know, why are you considering medical school? If in 5 years you think that you want to be close to done with school, and that can be a possibility with the PA profession, then awesome. But not just in terms of schooling. I think take a good look at like where you want to be. Do you want to be like, what part of the world do you want to be in? What do you want to be doing with your life other than your career? Like, do you have a family? Whatever it may be. I think it's just, I don't think that as high schoolers, we're really taught this in our society to really think about what we want. I think it's so easy to just move along in society and say, hey, I graduated high school, now I'm supposed to go to college or get a job and then go to grad school or just start working and have a family and have kids and blah, blah, blah. It's so easy to get trapped into that. And there's nothing wrong with doing all those things if that's what you want, but just take the time. Being a young high schooler, and I say young, I know if you're here and you're in high school, like probably don't feel young, but you're younger in your life as a whole, and you have so much ahead of you to just really think about what you want and go from there, like write it down, draw a picture, I don't know, and just go with what you want and where you see yourself. And it's okay if that dream changes too. Be okay with it changing and you decide to pivot and go a different route in the future. That's totally cool. I hope that helps. I get really excited about visualizing and just really doing what you want to do rather than what society tells you to do.
No, I believe that's wonderful. I believe we should all follow and take that advice into account, definitely. So once again, I want to thank you. Thank you so much for being here with us. And so, yeah, I think we all learned a lot from this presentation. At least I know I did. So I wanted to invite you all to reflect a little on this session today with these 3 questions that are over here. So what brought you to this session today? Was it your interest in becoming a PA? Was it because a friend of yours invited you? What are 3 major takeaways that you got from it? You know, what did you learn? And what do you want to learn more about? You can definitely write this or just answer them in your head, however you want it. Just, you know, let's take a moment to reflect on the session today. If you do decide to write, we want to highlight that it is not required, but we encourage you to submit it to our website for publication and recognition of your hard work and to enhance your future applications, as we mentioned earlier. If you want to learn more about pre-health shadowing and how to get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. And we are also accepting team member applications if you want to take on a more active role in PHS to lead projects and initiatives to be up here with us. Once again, we are humbly asking that if you are financially able to donate, that you please consider doing so. It costs a lot to keep our program up and running and free to all of you. So if you're someone who can afford it, or if you know someone else who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask you to spread the word about PHS to reach as many students as possible. Now, for the part that we have all been waiting for, earning a digital certificate for the virtual shadowing hours from this session today. The first thing you guys are going to do is go onto our website and find our professionals course pages and enter Ms. Khushbu course. There you can take our quick 10-question multiple choice quiz based on the content from the session today. You will have 30 minutes per attempt to earn 70% or higher to get your certificate. And we do know that sometimes technology can be difficult, and for this reason, we allow up to 2 attempts to take the assessment. But if by any chance you run into any difficulties, please do not hesitate to contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting about 30 minutes to an hour after the session to take the quiz, which I want to highlight will be open indefinitely. And finally, once you have passed, you can click the finish course at the bottom, the finish course button at the bottom of the professionals page, and there you can download your certificate verifying your virtual shadowing hours. I'm sorry. What happened over here? I'm really sorry. There we go. If by any chance you missed a part of the session or you want to go back and view other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find them via the professional pages on our website and take the post-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming events. We are currently booked every weekday through June for virtual shadowing sessions, so we definitely hope to see you guys over there. Once again, thank you all so much for joining us today, and please stick around if you have any questions, and myself and other team members will be happy to answer those. This shadowing session is officially over, and I invite you all to log off. Have a wonderful day, evening, or night.